A health alert as measles continue to spread nationwide. Cases in West Texas have grown to more than 100. Children and teenagers make up the majority of these cases, and nearly all of them were unvaccinated. Thanks for staying with us. I'm Felicia Rodriguez.
I'm Tiffany Kenny. The measles outbreak in Texas is raising questions for many about how to stay safe. Jade Jarvis spoke with a local infectious disease specialist about staying healthy. Jade?
Well, Tiffany and Felicia, the infectious disease specialist I spoke with says he's urging people to get their kids vaccinated and also to check their own immunity levels so that they can protect themselves and also stop this disease from spreading.
Unfortunately, the problem is these people who are not vaccinated are going to schools and they are mingling with other folks who may not have been vaccinated.
Infectious disease specialists everywhere watching the current measles outbreak in West Texas closely and urging parents to reconsider skipping recommended vaccinations for their children. The American Academy of Pediatrics recommends kids get their first dose of the measles, mumps, and rubella vaccine between the ages of 12 to 15 months and the second at about 4 to 6 years old, which for most people will protect them for life.
Most of the time, people are immune for the rest of their life. However, over time, you can lose that immunity, and so you can get a boost as an adult.
Dr. Olayemi Osiyemi is the chief of infectious diseases at Good Samaritan Medical Center with the Palm Beach Health Network. He says that decline in immunity can happen in your 40s or 50s or after developing a chronic illness.
Your primary care doctor can actually do the testing for most vaccinations and say, hey, are you still immune? If you're not, can we give you a booster?
The consequences can be serious if the disease spreads to people at risk, like those who are immunocompromised or the elderly.
Pregnant women certainly are at risk because of the baby, because they can have miscarriage.
For those on the fence, Dr. Osiyemi urges them to look at the historic data available.
What the incidence of measles, mumps, or rubella in this country is, and then when you can compare that with countries that don't have universal vaccination, you can see the complication death rate from these diseases, from these viral illnesses.
And there are some people who can't get vaccinated, like those who are immunocompromised or pregnant, so that makes it all the more important for people who can get vaccinated to do so in order to protect them. Reporting live tonight in Palm Beach Gardens, Jade Jarvis, WPBF 25 News.
And